the story of global health is one of astonishing success.
The impact of these things in one country affect all of us.
There are no neglected diseases, it's just neglected people.
Public health often doesn't get noticed until something is going wrong. And there's so much that public health does that it gets right.
I think just these four people here today are an illustration of the extraordinary influence Atlanta has on global health around the world. Not just one of these organizations, but they're just four of numerous organizations here in Atlanta that are transforming lives, saving lives, and ultimately protecting Americans through their work as in global health.
If you bring people together, form a goal together, and then collectively hold yourself accountable to it and march toward that goal and be responsible and measure on your way, you can achieve almost anything.
When you talk about global health is truly global, and by that what I mean is it's multi-sectoral. No one can work in global health in isolation. And that requires exactly what you just said. It's partnership, collaboration, coordination, and that's key to it. And it's between multiple sectors: public sector, private sector, as well as academia, and then most importantly with the countries. When you're looking at from a global standpoint, with the ministries of health,
The job is never finished. Even when we make amazing achievements like eradicating smallpox, there's always something else and we just have to look at COVID. There's always something else around the corner that's going to require the type of partnerships across organizations, like the individual organizations here that have built a network of partners. Not only in Atlanta, it's kind of truly like a global health hub with the institutions that you mentioned and many others that are probably represented in the room. Our reach really extends beyond just this city and beyond just the US.
So partnerships are really at the heart of global health. And for us, these partnerships really elevate the importance of global health, because we couldn't achieve the impact, and collectively we are able to achieve that impact and address the needs of populations around the world because of the partnerships that we are able to form here.
So I just want to recognize that for all of us, or many of us, being partnered with CDC is a key part of this global health community. They've got incredible technology, incredible experience, incredible relationships all over the world, incredible knowledge of epidemiology and laboratory science and surveillance for diseases. They follow trends better than anyone in the world, and they communicate with people all over the world in multiple languages. It is a gem.
Public health often doesn't get noticed until something is going wrong. And there's so much that public health does that it gets right. And how do we do a better job of communicating that, creating narratives around that, communicating what return on investment is to the people, to the colleagues, to the leaders that make decisions about appropriations and funding is really, really key.
And President Carter used to say, because we work with neglected tropical disease, his quote was, "There are no neglected diseases, it's just neglected people."
The goal has always been, at least in my lifetime, to help countries stand up these capacities, develop their own skills, do their own acquisition of the medicines they need, train their own nurses and doctors and epidemiologists, and carry that on behalf of their own people. And the story of global health is one of astonishing success. We have made that happen in a variety of ways. There are countries all over the world now that never had the capacity to recruit and mentor and deploy field epidemiologists that now do that on their own. It's in their own budgets. That's thanks to the investments from CDC and our program in TEFINET, for example. There are many countries now that we helped get started with annual flu campaigns. Now they pay for it and run it themselves, and they're prepared for the next pandemic. They know how to stand up a clinic really quick and deliver vaccines to stop whatever comes next. That's happening. We're not done with the job. For some, we're very close to the end. Thankfully, with polio, we're very close to the end. For many others, country by country, we're eliminating diseases or building capacities that they're taking on.
We are also connected that we can say these numbers may be coming from low and middle income countries, and therefore some countries may be isolated from the impact. I think the world is coming to a place where we all need to shout on top of our voices and say we are so connected that the impact of these things in one country affect all of us.